Whipple procedure has got a pretty complex name. It's a pancreaticoduodenectomy, and basically it's a procedure to remove the head of the pancreas, which would be let me backtrack. It's a procedure to remove the head of the pancreas and the first part of the small intestine, the gallbladder, and the bile duct. So think of it as a very complex procedure to remove 4 parts of the body. And this is where you got all these sort of intersection of all these different organs involved in digestion. The remaining body parts are sort of reattached to allow the body to continue to do what it's supposed to do as far as normal digestion. But it's a procedure that many years ago had a pretty high risk, meaning some of the people that went through the procedure didn't survive it. The outcomes today are definitely better than they were years ago because we have better methods, we have more experience, and so forth. In terms of why would someone want to do this, well, first of all, you got to keep in mind that if they do nothing at all, we know how that journey goes. The cancer will continue to spread, and most likely that person will die sooner from that cancer. So the reason why you would want to do the surgery is because, generally speaking, removing that cancer mass is the fastest way to prevent that cancer from spreading around the body. In some cases, having that procedure done can improve the 5-year survival rate by 25%, meaning that you're 25% more likely to be alive in 5 years if you have that done. Some of the limitations about it, though, is that it's kind of the cancer has to be clustered or focused in that area. If there's, let's say, if the cancer's metastasized all over the body, it may not be the best decision because you're going to get all this work done and then you still have cancer everywhere else to deal with. So there may be, in those cases, doctors may have to think of a non-surgical intervention or some combination where it's like, hey, let's kill off stuff in the blood. Once we get that down to a certain level and there's just appears like there's only this mass in that region of the body, then let's do surgery later on. So that might be a better strategy in some cases. So the point I wanted to make is I've seen patients with ampullary cancer and I've seen patients with pancreatic cancer get the Whipple procedure done. It appears to be like a good option for certain cases, not for every case. However, remember it's surgery and it does not address anything else in the blood. And so my opinion is that people need to think of it as one part of the treatment process and not the full treatment process, because removing the tumor is great, but what are you doing about the few cells that are in circulation that do not show up on a PET scan? And I think that's where sometimes patients get blindsided because they're told, hey, there's no evidence of disease, but they didn't consider the fact that they may not have enough cancer cells to show up on a PET scan yet or a CT scan. So I would recommend they continue to do some sort of anti-cancer strategies to minimize the likelihood that this cancer comes back later on.